the focal point of the work that we're doing in Pennsylvania and what folks are doing nationally in many, many, many quarters is focusing on health care. It is so basic, it is such common sense. And we can break it out into three key elements. There's the economics, there's the morality, and there's the small d democracy. Starting with democracy, in Pennsylvania, 68% of Pennsylvanians, in May 1st, Quinnipiac poll, 68% say they want guaranteed health care for all of our citizens. Pennsylvania is not exactly a wild-eyed liberal state. Pennsylvania it's a diverse representation of so much of America, and 68% of Pennsylvanians want it and they demand it. On the morality of the issue, we've gotten the Pennsylvania Council of Churches, similar to the Presbyterian support that came out just a few weeks ago. We got the Pennsylvania Council of Churches on board with our movement. And for medical providers, we've got PNHP, we've got the American Medical Student Association, we've got the nurses, PASNAP, the Nurses Union. These are the frontline medical providers. These are the folks who went into medical professional work because of a moral calling. They're not there to make mega bucks. They're there to provide health care. And yet their practices are interdicted, they're stopped, they're blocked by medical underwriters who come up with these formulas for profit, which drives what I call the profit-first insurance industry. It's not simply for profit, it's profit first, because their profit is guaranteed before a single health care service is delivered, and that is criminal behavior in every other industrial society in the world. We here in the United States, our politicians, Democrats and Republicans, have enabled this industry, have allowed this kind of behavior to be legalized, this kind of activity where the relationship between the patient and the provider is corrupted, corroded, and destroyed by money-greedy individuals who drive these industries. Now people say, well, if you put the insurers out of work, what will happen to all those jobs? Well, in Pennsylvania, we're talking about 80,000 people who would be temporarily displaced. But our legislation in Pennsylvania, it's Pennsylvania House Bill 1660 and Senate Bill 300, would provide a 2-year cushion for these individuals to go back to school, to find another job, and in many cases, these very insurance people who tell people no, 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 deny, 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 on the basis of experimental procedures or pre-existing conditions, that these individuals would be allowed a new start in life, a profession that is far more rewarding than having to tell people they can't have the health care that they desperately need to save their lives and protect their lives. It's a red herring. It's a phony argument. It's a false argument that's thrown up in our face all the time. Now, what we imagine in Pennsylvania, because I ran for the U.S. Senate and I ran on H.R. 676, that's a House bill, folks. There's not a bill in the United States Senate for single payer. I would have been elected and introduced that bill, would have been the person to do so. But here's the bridge, and this is the bridge legislation I want people to begin thinking about tonight. And that's H.R. 506, Tammy Baldwin's bill, that would provide federal funding for state-level single-payer solutions, and Bernie Sanders' bill, which is 2031. These bills would allow the fight for health care, guaranteed health care for all, single payer, to take place, I believe, in a place we can win, which is at the state level. John Conyers endorsed our legislation in April of 2007. And he did so because he felt at that time, and still feels so today, that the best way we can get this is in a state. And in fact, one of the extraordinary things is that we're now beginning to hear from conservative think tanks who want to see single-payer experiments at the state level. And what this really speaks to is our constitutional creation of power, federalism, shared power between the national and the state governments. What got the progressive movement where it did was happening at the city level in Milwaukee, the state level in Wisconsin, and finally went national under the first Roosevelt administration. This may be poli-sci 101 for everybody, but the reality is that federalism means that we have the opportunity to get this at the local level, at the state level, or the national level, and find the pressure points, find the areas where we can make the greatest advancement in the greatest and rapidest time period. And we believe that 2009 is our time. And that has also to do with the fact that we have a governor, Governor Rendell, who, though he takes a lot of corporate dollars, has a lot of friends in the insurance and pharmaceutical industry, we, being the clever, determined activists that we are, have gotten him to commit to sign to our single-payer legislation into law. And no other state in the union can make that claim. We've got a governor ready to sign our bill. Healthcare for All Pennsylvania. Think about what we're doing in PA. Let me just shift gears to what we're working on in the next week, which is to get a huge turnout to speak up loudly for guaranteed healthcare for all, something Donna spoke to, Norman spoke to, Diane spoke to, and Kay spoke to. We want to bring the Democratic Party back to the Democratic Party. Yeah. We want the representatives of the Democratic Party who are putting together this plan to stop playing games with our lives. Yeah. Stop playing politics. Stop destroying and enabling these industries to deny rights in our society. Publicly funded, privately provided health care marries the best traditions in American history, which is a collaboration between the public and the private. This, believe it or not, folks, is a centrist solution. Yeah. It's an idea from the left, it's an idea from the right, and it brings it together. It's a beautiful solution. Let's, like Tim keeps saying, take a deep breath and understand that this can be won and this will be won. We need to be determined. So what we need to do next week in Pittsburgh is everybody within, I'm going to extend the radius to 1,500 miles. That includes our good friends up in Maine and many of our friends in Florida. Come to Pittsburgh next week. Come to Pittsburgh next week. Go to pdamerica.org. Get information on how you can get there. Bring 5 of your friends, your family, your colleagues, your cohorts. Bring them with you. We want to show up in force in Pittsburgh. We want to send a message to our Democratic Party that it is our Democratic Party. It's not going to be hijacked any longer by those who think that corporate contributions to the party are more important than the bread and butter. And that's us. We are the people of the party. So Pittsburgh, next Saturday on the 9th, August 9th, we're going to gather in Pittsburgh from 9 to 5. And we got word today, I just got an email just before this gathering, that State Senator Jim Furlow, who was our prime sponsor on Senate Bill 300 and an avid supporter of H.R. 676, he's going to put together a press conference for us the morning of the hearings on health care and other issues. So we are down with this idea. We are going to get press. We're going to get visibility. In order to win health care for all, and we are going to take back America. Thank you.